Medicos, welcome to our YouTube channel, The Exploring Medico. I will be teaching your pathological portion. We will start from cell adaptation. Cell adaptation are the adjustment which the cells makes in response to stresses. Five process which occurs by cells for adaptation. First is hypertrophy, second hyperplasia, metaplasia, dysplasia, and atrophy. First, hypertrophy. Hypertrophy is increase in size of parenchymal cells resulting in enlargement of organ. It affects mainly muscle. Involves dividing and non-dividing cells. It is a process where mitosis occur. Hypertrophy may be caused by pathologically or physiologically. Physiological hypertrophy, for example, uterine myometrium in pregnancy. Pathological hypertrophy, myocardial hypertrophy in hypertension leads to valvular deformities. It is narrowing and stiffness to heart valves. Smooth muscles in pyloric stenosis. Hypertrophy of skeletal muscle in athletes. Hypertrophy contralateral organ after removal of kidney or adrenal on one side. Morphological features of hypertrophy. Grossly, in hypertrophy, gross appearance of affected organ is enlarged and heavy. In microscopically examination, enlarged muscle fiber and nucleus. Electric microscope, increased synthesis of DNA, RNA and myofilament. Myofilament is contractile protein in myofibrils. Molecular pathogenesis. In molecular pathogenesis, increased growth factors acting on cell surface causing activation of signal transduction pathway. In transduction pathway, chemical or physical signal is transmitted through a cell in series of molecular events. Outcome of hypertrophy, reversible on withdrawal of stimulus. Second is hyperplasia. It is increased in number of parenchymal cells. It involves only dividing cells where only meiosis is occur. Hyperplasia may be caused by pathologically or physiologically. Physiological hyperplasia, for example, hormonal hyperplasia in breast and uterus during pregnancy and following lobectomy of liver and bone marrow. Pathological hyperplasia, for example, endometrial hyperplasia due to excess estrogen, ductal hyperplasia in breast, skin in viral warts and non-healing ulcers. Morphological features of hyperplasia. Gross appearance of affected organ is enlarged and heavy. Microscopically, increase in number of cells. Electron microscope, increased DNA by regular mitosis. Molecular pathogenesis, increased proliferation of cells by increased growth on cell surface receptors and stimulating signal transduction pathway. Outcome, regress on removal of initiating stimulus and persistence of stimulus may lead to dysplasia and neoplasia. Metaplasia, it is a change of an adult type of epithelial or mesenchymal cells to another type of both cells. Types and examples of metaplasia. Squamous metaplasia, for example, bronchus cervix, calculidox, renal pelvis, urinary bladder, columnar metaplasia, Barrett's esophagus, gastric ulcer, bronchial mucosa. Barrett's esophagus is a damage to a lower portion of esophagus or tube. Osseous metaplasia, arteriosclerosis, myositis ossificans, cartilage in bronchus and larynx. Myositis ossificans is a bone formation in muscle. Morphology of metaplasia, mature cellular development from specialized to less well specialized and resistant cells. Molecular pathogenesis, the reprogramming of precursor stem cells triggered by exogenous stimuli to another pathway. It means regression of specialized cells to simpler state of transformation into another cell types. Outcome, reversible on withdrawal of stimulus and persistence of stimuli may cause progression to dysplasia. Fourth one is dysplasia. It is a disordered cellular development accompanied with hyperplasia and metaplasia. Type and examples: epithelial dysplasia, uterine cervix, bronchus, oral cavity, and esophagus. Morphology of dysplasia, disordered cellular development. Molecular pathogenesis, abnormal cell growth by mutation in genes. Outcome, mild and moderate grade regress on removal of initiating stimulus. Fifth one is atrophy. It is a reduction of number and size of parenchymal cells of an organ. Atrophy may be caused by pathologically or physiological atrophy. For example, lymphoid tissue with age, thymus in adult life, gonads after menopause, brain with aging. Pathological atrophy, starvation, weakness, emaciation, anemia, ischemic atrophy, brain atherosclerosis, renal artery atherosclerosis. Disuse, immobilization or in plaster cast. Endocrine, hyperthyroidism, neuropathic poliomyelitis. It is an inflammation of spinal cord. Morphological features of atrophy: grossly loss of neutrons, microscopically cells become smaller in size, electric microscopically reduction in structural components of cells. Molecular pathogenesis, it is imbalance in cellular protein pathway causing reduced cellular protein synthesis and increased cellular degradation of protein. Thank you.